Trauma is a multifaceted experience that imprints itself on the mind, body, and spirit. It's not surprising then that the emergence of trauma can be quite prevalent during psychedelic journeys. These altered states of consciousness open up the doors to the subconscious, bringing forward elements that may usually be hidden or suppressed. And so it's critical for both individuals embarking on the journey and the facilitation team and integration therapists to understand the ways in which trauma can manifest during these experiences. Hypervigilance and the inability to surrender is one. Trust and surrender, they're not just poetic terms, they are essential ingredients in the alchemy of healing through psychedelics. Trust can be broken down into several layers. Trust in the substance that you're taking, trust in the guide or therapist, and most fundamentally, trust in oneself. Trust removes the guards that you've put up, consciously or subconsciously, allowing the medicine to perform its healing work. Without trust, you may resist, fight, or altogether miss the healing insights and emotional releases that psychedelics can offer. Surrender, on the other hand, is the art of letting go. It's giving yourself permission to feel, to explore, and to be vulnerable. Surrender is not about defeat. It's about a partnership with the experience. It means allowing the experience to unfold as it will without trying to control or direct it. It's about relinquishing the ego's need for control and entering into a state of acceptance and allowance. The role of trust and surrender becomes even more crucial when navigating challenging or scary moments during the trip. Embracing these two concepts can significantly shape how one perceives and interacts with trauma-related emotions and memories. Often, people who have significant trauma histories find it difficult to surrender to the experience, and they may resist the effects of the medicine, leading to what some may call a bad trip, with emotional overwhelm, crying, screaming, or panic. For me, I recently facilitated a psilocybin truffle retreat in the Netherlands, and we had a case of someone who experienced just that. Despite all of the preparation work and even years of therapy, the idea of sitting with psilocybin, a substance that could lower the defenses and open up the subconscious, was just too much for this client. And she resisted. She resisted with every force in her, struggling against the medicine as the effects were coming on. And then ultimately, she went to sleep. Now, that's kind of rare for the dose level and the music that's happening in a ceremony, but she completely went to sleep. And when we talked about it in integration, she completely forgot. She did not know that she had been fighting and going through all of these challenges. So it's really interesting when you see someone who sits up and they're rigidly, kind of assessing everything that's going on. You can tell that they're not allowing themselves to get into the medicine. They take off their eye mask and they refuse to go inward, usually out of fear of what they might see or what they might do if they see some difficult material. So these are just things that we will be talking about in addition in our live sessions. In this case, in subsequent journeys, we worked with this client to further identify what she was afraid to see. And then we engaged with her protector parts with an internal family systems lens and these certain practices that would help her engage with her protectors to get them to ease up. She ultimately was able to relax into the medicine's effects and have a productive journey. Another thing that can come up is emotional surfacing, and it's really one of the most immediate ways that trauma shows up. During a psychedelic journey, emotions are often heightened, but they're also less filtered. Individuals may experience sudden bursts of sadness and anger or overwhelming joy that can be directly related to their traumatic past. These emotions can emerge without any immediate context, or they can be connected to specific visions or hallucinations. Next up is physical sensations. You know this, trauma resides in the body and not just in the mind, and during a psychedelic experience, individuals may become highly attuned to bodily sensations. These can range from tension in specific muscles where trauma may be stored, or it can lead to more vivid somatic experiences like the feeling of being choked or bound. Some people report feeling like they've undergone surgery. And these physical sensations really do offer an important entry point for therapeutic interventions, such as somatic experiencing in the integration phase. The most common way that trauma manifests in psychedelic experiences is with flashbacks and vivid memories. And it's generally memories that are related to specific traumas. These can be visual, auditory, or multisensory in nature. And while flashbacks can be distressing, they also provide an opportunity for individuals to confront and work through these memories in a therapeutic setting. Next up is projection and transference in the trauma reenactment. So during psychedelic journeys, the phenomena of projection and transference can really play pivotal roles, especially in the context of trauma reenactment. Projection involves the unconscious transfer of one's own feelings, desires, or fears onto another person or an aspect of the experience. In the heightened state of awareness induced by psychedelics, individuals may project their inner conflicts or their traumatic emotions onto the guide, the therapist, or even the symbolic imagery that they encounter, misinterpreting these as external sources of their distress. Transference, on the other hand, occurs when individuals redirect feelings and desires, especially those that are unconsciously retained from childhood experiences or significant relationships, and they transfer it towards someone present in their therapeutic process. During a psychedelic journey, this can manifest as an intense emotional connection to or aversion to the therapist or facilitator, often mirroring past relationships or traumatic interactions. This transference can deeply influence the journey, bringing forward relational patterns and dynamics linked to the trauma. Both projection and transference during a psychedelic experience offer unique opportunities for healing. By recognizing and working through these psychological mechanisms, people can gain insight into their trauma's relational aspects. Therapists and facilitators, aware of these dynamics, can guide the individual toward understanding and integrating these experiences, turning them into powerful moments of insight and healing. And in doing so, the journey can become a transformative space where past traumas are not only revisited, but also recontextualized within a therapeutic framework, paving the way for profound emotional and psychological growth. Another is archetypal imagery. Sometimes trauma appears in more symbolic forms. The appearance of menacing figures or shadowy landscapes or chaotic scenarios can all be projections of inner turmoil related to past experiences. Understanding these archetypes can offer significant insights into the nature of an individual's trauma and how it affects their broader psychospiritual framework. In fact, in my own case, I sat in ceremony with psilocybin mushrooms. This was right after my mother transitioned and left this life. I happen to have had a quite toxic family and upbringing. If you know the adverse childhood experiences score, mine was a 7. Well, in this psychedelic journey with psilocybin mushrooms, I saw a scene from my early childhood. In fact, I was not yet 2 years old in this scene. I saw in our household all sorts of trauma and conflict, but it was represented as this dark mist. And I saw this mist bouncing off of my parents, my sister and brother, and me. I saw myself as absorbing this darkness that I was able to understand was associated with this feeling that everything was my fault, that I was wrong and I was bad. Now, you may say, before the age of 2, you probably wouldn't even have memories. And that's what I thought. I actually was able to call my sister after this. She's 12 years older than me, so I knew she would remember the apartment that we lived in and the details. And at first she said, there's no way that you could remember that. You were just a baby. But as I recounted certain details, she believed me. I did not tell her that I had taken psilocybin mushrooms, but alas. Also in that journey, because my mother had already left this earth, I could see my mother going off into the light, and I was able to give back that darkness. Again, it was in the scene where I was just a baby, but I gave back that darkness, which was really my mother's unhealed trauma from her childhood. Coming out of that experience and in integration sessions, I recognized that I felt so much lighter. I had never consciously thought, oh, everything bad that happens is my fault. But understanding it from that psilocybin experience, I could see how that had really impacted so much of my life. And so this is just really some of the powerful ways that trauma can be seen in a psychedelic journey. Another way that trauma can manifest is through dissociation and fragmentation. Trauma can often lead to psychological mechanisms like dissociation as a way to cope with unbearable experiences. During a psychedelic journey, moments of dissociation or this sense of fragmentation might occur. And here, the role of a skilled therapist or facilitator is really crucial in ensuring that the individual can become re-anchored and safely navigate these states. The other thing that can come up are triggers and sensitivities. Sometimes the setting or the context of the psychedelic experience itself can trigger trauma. For example, the sensory input, like a certain smell or even the texture of a fabric, can act as a trigger. These sensitivities might be previously known, or they could surface unexpectedly during the experience. Voices and songs can also trigger memories or emotions. Reactions from participants or facilitators can bring up memories of trauma, such as being silenced or being told that you're too much or you're taking up too much space. So in conclusion, understanding the potential for trauma to surface during a psychedelic journey is really crucial for both preparation and integration. It allows the individual and the therapist to take appropriate safety measures, including pre-journey discussions and setting intentions that are geared towards healing. Furthermore, recognizing these signs can open doors for deep transformative work, turning the challenging aspects of the journey into opportunities for resolution and growth. So understanding trauma is the first step in addressing its profound impact. As we move forward, we will explore how psychedelic therapy can play a role in this healing journey.